Welcome to this special broadcast here on News Mobile. And today, in fact, we are discussing about black fungus. Now, black fungus has been there in the news everywhere. The cases have been reported. In fact, Odisha has just detected its first case of black fungus in a 71-year-old patient who is in fact also is a COVID-19 patient and has a known history of uncontrolled diabetes. While Maharashtra, Gujarat, they have also reported a rise in the cases of the rare but potentially fatal infection. Now, joining us right now and discussing more on this is Dr. Ravindra Gera, the director and head of department of Max Healthcare, Gurgaon. Thank you for joining us here, Doctor, on News Mobile.
Thank you, Shivani.
Doctor, so the first question is, of course, that what really causes black fungus? And especially, we are seeing this in diabetic COVID patients. So what is the reason behind that?
See, as the name suggests, black fungus is particularly happens because of a mold that is called mucormycetes. It's there in the air, it's there in the soil, it's there in the plants, it's there it remains as commensals even in your nose and the nasal mucosa. And in normal patient, it doesn't lead to any problem. If our immunity goes down, then it leads to a fatal infection that is called mucormycosis, also labeled as black fungus, because it devitalizes the tissue and makes the tissue black in color. That's why it is labeled as black fungus. And it happens mainly in post-COVID. Nowadays, it's happening mainly in post-COVID state of affair, and particularly those who are immunocompromised, like diabetes, cancer, transplantees. These are the patients which all leads to black fungus.
Right. Can a black fungus spread from person to person? If somebody, for example, gets black fungus, do they need to do the doctors, nurses, and their relatives need to take extra precaution to make sure that it doesn't spread? Or is it something that doesn't spread from person?
Really, it doesn't spread from one person to the another, but the hygiene should be taken care of by the doctors, by the attendants, all other staff members.
Right. What are the black fungus symptoms and why is it so deadly?
See, deadly because, as I told you, it's black fungus. It leads to blackening of the tissue. It leads to thromboembolic phenomena wherever it enters, whether it enters in the nose. Primarily, it enters through the nose, goes into the sinuses, and then it goes into the orbit, eyeball, and then sometime in the brain. And mainly, it leads to nasal obstructions, bleeding from the nose, pain around the nose or maybe around the eye, lid swelling, and can lead to numbness in the area of nose and the sinuses and headache as well. And sometimes if it goes down into the lungs, can lead to blood in the sputum. So these are the primary symptoms of the fungus. See, in most of the patients, wherever it's being diagnosed early, the result of the treatment is very good. It should be investigated at the earliest. If any patients post-COVID, diabetic or immunocompromised, if finds crusting in the nose or nasal obstruction or blood in the sputum, should consult the ENT doctor at the earliest. In this field, there are three doctors which are really important. One is the ENT doctor, and then the ophthalmologist, and then the pulmonologist if it goes into the lungs. So we have to attend it at the earliest. Any patient who is post-COVID or recovering from the COVID should take care of these symptoms. And nowadays we are getting on an average maybe 2 to 3 patients in a week. Earlier we used to get 5 to 6 patients in a year. So that is the level of incidence which is happening in cases of black fungus.
Right. Also, we are seeing cases of the black fungus, the infection leading to a loss of maybe eyes, or is that something which is also connected to black fungus, losing a body part?
Yes, you're very right. Because if this black fungus invades the orbit or the eyeball, it leads to central retinal artery occlusions and there can be endophthalmitis. If there is endophthalmitis or central retinal artery occlusion is there, then the patient's vision will be lost. And if the infection has spread beyond the eyeball or into the cone of the orbit, then in these cases, we have to remove the eyeball. And sometimes if the sinuses are involved and the jaw bones are involved, then we have to sacrifice the jawbone even sometimes. So these are the two things we have to do a radical kind of surgery. We don't see that the patients do respond to the medical therapy, but the mainstay of treatment of the black fungus is the radical debridement, means that whatsoever fungus is there in any part of the nose and the sinuses or in the eyeball, we have to remove it so that the further spread should not happen. And we had a vitalized tissue where the antifungal drugs can work.
Okay. Also, the basic cost of the injections for black fungus are exorbitant. This is a huge cost for the patient, of course. How can our health infrastructure really evolve to tackle black fungus in our country as more cases come up?
Yes. See, the mainstay of treatment, as I told you, if it is being detected early, the radical debridement, and post of that is the antifungal treatment, in which cases we gave the injectable drugs, injectable antifungals, amphotericin lipophilic form, which is expensive, varying from patient's weight. It can cost you from 4,000 to 8,000 bucks, 8,000 rupees. So, to tackle the situation so that we should not have black marketing or other things in the market, the government should step in, should have the procure the drugs in a significant amount. And secondly, we should, if we want to bring the cost down of this therapy, then yes, the government should bring this antifungal drugs into the price control system, which is, I think, any government of any country can do easily. If we have to avoid this endemic or maybe whatsoever form of this disease takes in due course of time, if it goes haywire, then it's really bad. And most of the Indian patients, if you take around 8,000 bucks per day, and it goes for maybe sometime we give for 3 months. So the cost is very high. So if you want to bring down the cost, the government should think over it. But we should not land ourselves in that situation so that we can avoid these situations. So we should do some preventive measures. One is the patients who are diabetic should consult the endocrinologist during the COVID treatment and should consult the physician so that there should not be a misuse or a overuse of the steroids, because the steroids are the culprit. One is the COVID itself, which decreases immunity, and then the diabetes, which increases the blood sugar level, and then the COVID itself increases the ferritin level. So this is triple whammy. So if we can prevent the misuse of the steroids and proper management of this of the COVID, then we can avoid this infection at large in population. And one more thing is that most of the time, whatsoever the diagnosis of COVID somebody hears, he will start with the steroids. So don't try to follow the prescriptions of other patients that this patient was COVID and these were the symptoms. And most of the Indians, they do that my doctor has given this and you start this. So that should be avoided. Misuse and abuse of these corticosteroids should be avoided. And then secondly, the overuse of antibiotics, which is happening in COVID therapy. So these two things should be taken care of before landing ourselves into an endemic or maybe an epidemic of the black fungus.
Right. I'll also ask, India is vaccinating slowly. Can you give some tips to our viewers on what to do on their vaccination day? For example, should they take a painkiller before the vaccination, or should they have a breakfast, or should they have a full meal before leaving? Could you give us some do's and don'ts for our viewers?
See, it's not at all related with the meals. You take proper meals. Taking any kind of painkiller prior to the vaccination is not a good idea. So if even because when you inoculate any patient, there are bound to have a little bit of symptoms of viremia. Little COVID effects might be there, myalgia, fever. Then you can take the over-the-counter drugs like paracetamol tablets if required. Otherwise, it's really not required in most of the patients. And I just want to tell my viewers, vaccination is the safe thing to have. One should and everybody should go for it. And now the government is still inoculating the large population of India. Let's hope that this drive becomes successful so that we can get rid of this pandemic at the earliest.
Right. Also, thank you, doctor, for all those great tips and a lot of insight that you have on black fungus. So before we end this interview, I want to ask you about the drugs. The fake drugs which are in the market right now. So a lot of drugs like remdesivir, there are a lot of news reports coming in that these drugs are indeed fake. They're not real. How can our News Mobile viewers be careful when it comes to drugs and the authenticity of the drugs? How can we know that, okay, this drug is fake, this drug is not is real? Can you give some tips to our viewers on that?
Yeah, most of the time it should be taken under the supervision of the qualified doctor. And nowadays you see in India, the drugs like remdesivir, we are getting fake drugs in the market because even in rural area, the people have started giving the remdesivir. And remdesivir is a drug which should be given in a set of patients which are really in need of it. It should not be misused. Then how to avoid the fake thing is, yes, it's the government responsibility to take care of the people who are black marketing and manufacturing the fake drugs. But one should try to take in a good hospital under the supervision of a doctor that a patient can avoid the fake drugs, because in good hospital these things really doesn't happen. But it's very tough for the patient to decide whether it is a fake or the real one. And I think government should step in to control over this, because this is an issue of the law, and government
Right.
is in.
Okay. So the government should step in, you're saying, to make sure that the fake drugs market is busted, which I think there are a lot of cases, of course, of the police cracking down on fake drugs. Thank you so much, Dr. Gera, for your time here on News Mobile and your deep insights on black fungus and the other, of course, issues related with COVID-19 and the treatment when it comes to COVID-19 patients. Thank you so much.
Thank you, Shivani.